County, there's one location that you can get an abortion, and that is Berkshire Medical Center in Pittsfield, which is a hospital. And so this has been a very interesting feature of my research, has been looking at what it means to have hospital-based abortions be your main source of reproductive health care, or your main source of abortion as reproductive health care. And now looking at this is when you have a twin who's a statistician, and you get like a pretty graphs too. So I get the concept. This isn't. So this graph shows the percent change in the number of abortions of both in Massachusetts, which is this red line right here. It's the EOHHS Region 1, which is the Mass Department of Public Health region that they put Berkshire County in, like Western Massachusetts, and then actual Berkshire Medical Center, a number of abortions performed. So as rates have been declining in Massachusetts and in Berkshire County, in the Western Massachusetts region, they have been increasing at BMC, and there are specific reasons for that, or correlations, statistician twins. So in 2009 was actually when the Face the Facts campaign began, and Tapestry and Berkshire Way point to that moment as a point when teens, but also other people in the county, were becoming more aware of resources and starting to access more resources. So there's a potential correlation between people being aware of resources and reaching out to Tapestry Health and being able to be referred to BMC as. The next nearest place to get an abortion is there's a Planned Parenthood in Springfield. Also another hospital for Big State, but it's a different context. There's a Planned Parenthood in Springfield, and a lot of people before would just drive that way to the Big State. It's hard to find out where you can get an abortion in Berkshire County because it's very difficult to advertise at a hospital. You don't want protesters, and you don't want this to become like a known stigmatized part of your practice. So the idea is perhaps that Tapestry Health and Berkshire United Way were able to make that research more available. Then there's also in 2014, going up to 2015, this is in the time period when North Adams Regional Hospital closed, and they would provide abortions before this time. So there's the idea of now most of the providers who were providing in North Adams kind of stopped or went to BMC, which is what I'll be talking about in a few slides. So BMC became like the main site, and the number of abortions went up. Okay, but this is now just breaking down the idea of what it means to have hospital-based abortions and clinic-based abortions. This is another chart that my statistician twin. She did my thesis. This is showing the facilities, the actual places where you can get abortion in Massachusetts compared to where abortions are actually being performed. So green is just private physicians' offices. Red is abortion or non-abortion clinics, but like separate clinics apart from hospitals. And blue is hospitals. So as you can see, hospitals and private physicians are like aplenty who are willing to perform this procedure, but clinics make up over 80% of all the procedures actually performed. And there are lots of reasons for this in terms of abortion being a stigmatized procedure and providers not being able to provide in larger practices, for hospital policies, for opinions of other providers of practice. And clinics have become that main source, but also hospitals are much more difficult to get into for a procedure. Like if you look up NARAL makes lists of all the places you can get abortions in each state, which is interesting because the one for Berkshire County is wrong. They're telling you about Adams Regional Hospital still, even though that's not a thing anymore. So they tell you explicitly in that, like, try to go to a clinic if you can, but it will take longer and be more expensive at a hospital. So that's another reason people might go to clinics. But the hospital here, I worked specifically with Dr. J, that's a pseudonym that I've given her, and she's not here today, so I am not going to say her name, although she's been wonderful and so supportive throughout this whole project. Dr. J is the only provider in the county who accepts referrals for abortions. And what that means is that some providers will provide abortions for their own patients if they come in, that's all very down low, and it would not take outside reaching in. But at BMC, Dr. J actually keeps time slots in his schedule open for people to come in and call in, so they don't have to like fit them into a schedule 3 or 4 weeks out. They can just come in each week. And this is not, so when I say she's the only provider, that was like kind of scary to me at first. Like, oh my gosh, no one wants to provide this, and she very quickly was like, no, don't even think that. All the providers in this county are very committed to healthcare. Most, if they could, would want to provide full spectrum healthcare. However, because resources are stretched so thin, we're in a rural area, it makes no sense to have one person who is doing, like, who keeps the space and does most of it. But still remains, she's the one provider. Yeah, so Berkshire Medical Center, is the only site in the county where you can get abortions, would get surgical abortions, excuse me. So other places where they provide medication abortions might not have the space facilities to do surgical or aspiration abortions. So when we're talking about surgical abortions in the county, we look specifically at BMC and Dr. J and her practice, because that is what is being provided and available if you have an abortion in Berkshire County. So at BMC, they only do elective terminations up to 12 weeks and 6 days, first trimester procedure. It's fairly early still. So as we move forward, know that we're going to be talking about surgical abortion in the county, and this is it. So if a pregnant person was seeking abortion and got it at BMC, this is the procedure. From some script. So it's a 3-day procedure. I'm just going to go over it like pretty quickly. But the first day, people come in on Monday. These are the slots she has available. So patients come in on Monday. In her office, it's the initial consultation. They do an ultrasound and talk about options for the actual procedure. Dr. J very much believes that surgical abortion is, because you have access to the facility if you're here, that this is a better option in some ways, because you can be more sure that all the pregnancy tissue will be expelled, because otherwise in medication abortions there's a higher failure rate, which is still very low, around like 5 to 8%, but then the chance that you have to come out and have an aspiration procedure anyway is higher. So surgical abortion is more effective in that way. And then she'll talk about the risks of the procedure and sign a lot of paperwork. Typically takes like 30 minutes to an hour. Then on Thursday, patients come back to the office and they have a little like thin rod of seed called laminaria. Dr. J will insert it into their cervix, which absorbs water from the body overnight, and so it's like slowly dilates the cervix in the gentlest way that you can do that. And that takes 5 minutes in the office, but like around 15 minutes, because that's crampy and pretty painful to people. Dr. J tells patients to lay down and make sure that they're feeling fully okay before they get up and go